Good morning. My name is Betty Ndai. I'm a counselor and a social worker working with C&K. As we are talking about the SGBV cases during this COVID-19 period, we can see a large percentage of school-going children affected by this COVID-19 pandemic, demonstrated by closure of institutions of learning. Many school-going children, including adolescents, girls, are now staying at home because of this COVID. Okay, COVID is a respiratory disease spread from person to person caused by coronavirus. So the measures which was taken by most of the countries is lockdown and stay at home so that they can stop the spread of this disease. These measures which were taken in putting the vulnerable groups, including women, girls and children, at more risk. This situation poses a serious public health risk and disruption of social and protective networks, loss of income, and decreased access to services to everyone. All can exacerbate the risk of violence for women and girls and children. This continues to pose a great risk in Kenya because women and girls and children face increased and multiple challenges in including physical and psychological violence related to family confinement, isolation, and economic vulnerability. So we as the community, me and you, we should try and sensitize, because most of the time now we cannot meet in groups, we cannot meet in meetings. So the best thing we can do is to meet on social media and try and teach and explain and talk to girls in case of you have been victimized. What can you do? What are we supposed to do as the community health workers? So as we can say, we should try and explore innovative and practical ways of these girls to report violence, including sharing referral details, and maybe in event of where the person has been victimized, the victim requires access to shelter, security, and medical care and legal services. And also the authority should also provide a toll-free hotline numbers for GBV cases, information response and psychological first aid, tele-counseling and referral services. That is, we have toll-free numbers, that is 1190, 1195 and 1196. In case of any victimization, the survivor can report to those numbers, and so that they can seek immediate post-violence services. Because you see, most of these cases where we can see every day in the social medias, in televisions, radios, these cases are rising, and it is a major crisis also that is affecting the community at large. So if we can try and reach as many people as possible, it can be at least detained, it can be helped, and we can see from a point of view, because most of these girls at home, and we can try and as much as possible to save them from early marriages, forced marriages, from defilement, and children getting pregnant every day. So it is up to me and you to try and help so that we can try and contain this crisis. So stay safe, stay home, protect yourself from COVID. Thank you.